So the next person and the final speaker, I think, for this afternoon that I wanted to introduce is Dr. Ashley Bigaran, who's a senior exercise physiologist at Austin Health. Oh, and Blake as well. Sorry, I just saw you on the list. Is going to join us as well, who's also an exercise physiologist at Deakin University. And yeah, that's about it. They're going to tell us about the benefits of exercise for individuals with brain cancer, an interactive exercise session, which will be good. Get us up and going. Come on up, guys.
Good afternoon, everyone. Thank you for the lovely introduction, Marina. As mentioned, my name's Blake. I'm an exercise physiologist at Deakin University and also at the Olivia Newton-John Cancer Centre. So we have the opportunity to work with a range of individuals, whether they are with cancer diagnoses that are either undergoing treatment or preparing for surgery, recovering from surgery, or maybe not even undergoing treatment at all. So just working with those individuals to do what we're going to speak about today and go through some exercise and the benefits that can possess and the meaning of it as well for individuals. So we start with, I guess, what is exercise? So by definition, it's an integrated system approach that puts every cell, tissue and organ to the test when activity or intensity levels increase. So effectively, it's stress, it's a test for the body, and it requires a response. So the body does that, it raises its heart rate, the muscles contract and utilise fuel to achieve an outcome and meet the demands of the stress. And what is so fantastic about that and fantastic about the body is that it's able to adapt to that stress. Similar to a test in high school, the more you do the test, the easier it gets. So our body's able to adapt to the stress that it sees and experiences and get stronger or fitter or more capable as a result. And there is a distinction between what we traditionally think of as physical activity and exercise, and both absolutely have their place and are really valuable and beneficial for people from all walks of life. Physical activity can be something as simple as walking down to the shops to get a coffee or to getting out in the garden, kicking a ball around with friends or having a dance. And that's often what we sort of talk about with individuals we see. So they come in, we ask them about, well, what does your exercise regime look like? And yeah, they walk to the shops, they garden for a few hours, veggie patches, chores, and these sort of incidental physical activity tasks, as I mentioned, are fantastic. But there is just a slight distinction between physical activity and exercise. And when we think about exercise, we can start to think of it as a form of medicine. And just as we do with medicine, we think about the type, the dose, so how much, the intensity and its action, and all that is tailored to the individual and to the response that we want to get. So it's very specific, and with that dose, we're able to achieve a range of benefits for that individual. So when we think about some sort of broad exercise guidelines and recommendations, if we're able to accumulate 150 minutes of walking or cycling, or what we call aerobic exercise, which is sustained heart rate raising exercise, we can see benefits such as reduced cancer-related death, reduced cancer-related recurrence and increased survival, reduced risk or sort of experience of heart disease, as well as a range of other sort of comorbid benefits, and enhanced quality of life. And coming back to that link between exercise and physical activity, often if we're able to do the exercise, it can support individuals engaging in those physically active tasks. So if it is, and that's often where the meaning lies, we often point to these points, but an individual who wants to get out in the garden, that's where the meaning is, or they want to be able to walk down to grab a coffee. That's where their meaning is. So we want to support individuals to build the capacity and the function to do that or maintain it. And then looking at some, I guess, broader exercise guidelines, We look at, again, the distinction between aerobic exercise, which is that heart rate raising physical activity, that exercise. So looking at walking or cycling, just getting that heart rate up and maintaining it for a period of time. And the other type we look at is resistance exercise, which is the exercise that stresses the muscles, the bones, and those tissues. Something like body weight exercises or lifting weights, pulling on resistance bands. So what we look at, and we come back to that dose, is and experiencing a myriad of benefits as well. So generally across the board, if we're able to get 3 aerobic exercise sessions a week, so something like a walk for 30 minutes, in combination with a couple of resistance exercise sessions, so that could be, and we'll go through some examples of what that might look like soon, but lifting some weights or doing some body weight exercises can have some really fantastic benefits in related to cancer-related fatigue. We're looking at enhanced quality of life, physical function, with really strong evidence to suggest that and experience of that as well as some emerging evidence around sleep and even mental health and those other benefits. And when we look more specifically at the benefits of exercise for people with brain cancer, we see enhanced cardiorespiratory fitness and increased ability to engage and willingness to engage in physical activity. The research sort of finds that after diagnosis and even undergoing treatment, that the rate of engagement in physical activity drops quite significantly. And that can be a range of barriers, whether that's sort of reduced self-efficacy or some fear around it, a little bit of unsure or not knowing what to do or how to do it as well. So that's where we like to come in and support people. But what has been found is it's incredibly safe, incredibly effective, and something that should be part of the sort of, the process and the treatment. We also look at some more cognitive and sort of psychosocial benefits, increased cognitive function and attention span. One of the more common symptoms and side effects is that brain fog, so that can help sort of work through that. Reduce symptom severity and reduce fatigue, which can be a couple of the more challenging areas of brain cancer. And it does seem a little bit counterintuitive that something like exercise, which costs energy or sort of can induce some fatigue, can be beneficial at the same time, but it does have and can create a bit of a fatigue sparing effect as well, where it can create some energy and long term sort of enhance that energy reserve, allow someone to pull more, have a sort of fuller battery and pull more from that. Some more sort of specific tissue related benefits such as muscle mass, muscle strength, reduced body fat and enhanced balance, which from a falls risk perspective and sort of comorbid perspective is really important. And that comes back to, as I mentioned before, being able to participate in the activities that have meaning, that sort of contribute to that quality of life. So whether it is the garden or even just independence around home, getting in and out of chairs, getting up and down stairs, can have a really powerful impact. And that does link in with enhanced quality of life, reduced rates of anxiety and depression, and reduced psychological distress as well. So exercise is often seen purely as, I guess, a physical stimulus and sort of physical space, but it does have some fantastic sort of psychosocial and cognitive benefits as well. So what might an exercise program look like for people with brain cancer? It's not as simple, or it's not often as simple as just reaching those guidelines. Often that is where we want to get to, but that doesn't mean we have to start there, because that can be a bit of an overwhelming process. It might not be a realistic sort of starting point. So we want to find that realistic starting point, and that becomes down to a lot of different factors that we look to consider as exercise physiologists. So that comes down to symptoms and severity, whether it is brain fog, fatigue, balance, I guess that exercise tolerance or physical function, and where someone can start. It might be something really low level, just for a classic example, just moving one joint, or it might be something at higher level and moving some weights with some bigger movements. Treatment as well, whether someone is leading into surgery or recovering from surgery, whether they're currently undergoing radiation or chemotherapy. And that also is day to day as well. We know that there's going to be some days where those symptoms and that severity is a lot more significant, and we need to temper our expectations and what we do on those days, versus there might be days where we're feeling better and we're able to do a little bit more and get more of that stress and stimulus. Also looking at the broader sort of medical profile and other conditions that may play a role. Things like blood pressure and blood glucose in diabetes do have really important reactions with exercise that we need to consider, but also fantastic benefits, as well as exercise history. And coming back to that big one towards the bottom there in goals. As I said, where's the meaning for that individual? What do they want to be able to do? As I said, we point to all these fantastic benefits, but it comes down to where that meaning is, where that quality is, and how we can support someone being able to do those things now and long term. And that's where we use those things, we consider those things to formulate that dose. So how much exercise are we doing? How intense is it? How hard is it going to be? What type? Do they have a preference, or is there a safer option for them to participate in? So we formulate that dose and prescribe it based on that. And similar to, and what, as I mentioned before, in terms of that adaptability, we're always modifying that dose. So that dose will change as the individual changes. So the stimulus or the dose gets harder, or there might be times where we have to reduce that dose, depending on what they're going through and how they're feeling. And a bit of an example exercise program that we may formulate. So looking at resistance training, some different movements, and generally we're looking to support that physical function, we're looking at a broad and diverse range of movements. So something lower body, where we're sort of a classic example is a squat. I won't do too many squats up here, I promise. But that might be the base exercise, but someone might not be able to or might not feel comfortable completing something like that. So we regress it, whether that's adding some upper limb support and holding onto a rail and doing a squat, or sitting down and standing up from a chair. So mimicking the movement, but finding what is the tolerable and correct or manageable starting point for that person. And then we're able to sort of take those steps and build it up. And we can build it up if someone is managing that really well. We might be able to add some weight or add some external load or challenge them with a more complex movement. Looking at something also sort of single leg, something like a step up, even standing on one leg and challenging the balance component, or it might be a lunge or something like that. So looking at some different movements to challenge one leg at a time, again, just to support that person participating in day-to-day activities and enhancing that function and independence. Some other sort of examples of some different movements, some anti-rotation, so twisting, moving the body, or even resisting sort of motion, so being able to hold themselves in place, whether there's a band or something pulling them across, and just being able to maintain that control. Again, just trying to mimic activities of daily living, provide someone with the support and the strength and the function to participate and withstand those. And then upper body, both pushing, so it might be pushing off a wall, or it might be a push-up on the ground, it might be pushing dumbbells or a band, or pulling, such as a row, so pulling something towards you, or pulling themselves up on a bar or something like that. So it's a really diverse and broad spectrum, what exercise can look like. But we just, as I said, it's about considering the individual, considering the guidelines, finding that tolerable and appropriate starting point that they feel comfortable with, that we feel comfortable with, and then taking those steps up towards meeting those guidelines and experiencing those benefits. And then looking at the aerobic exercise, so the more continuous training, generally aiming for sort of 3 times per week of a moderate to vigorous intensity. That can be walking, cycling, cross-training, anything that raises and sustains that heart rate, and looking at a duration of 30 to 60 minutes. Now, as I said, that's not necessarily where we start. That's what we might want to build up to. So if someone can only tolerate or withstand 5 minutes of walking, that might be where we start. Or it might be doing 2 minutes and then taking a break and then doing 2 more minutes and just building that over time as the person adapts. And as I said, it's malleable, it's modifiable. We change it if they've had a recent treatment that they're feeling quite under the weather or quite fatigued or experiencing some side effects. Then we reduce it, we change up the intensity. It's about sort of, modifying and adapting to the individual and allowing them to move forward. So that can be a lot of information, and if I'd wholeheartedly recommend that if it isn't something you feel comfortable with or you would like to take that, or individuals want to take that extra support and extra guidance, to look into speaking to an exercise physiologist or a physio, both engaging in that day-to-day physical activity around home as well as the exercise can help us just move forward towards those benefits and maintaining that function and independence. So finding an exercise physiologist is something that's really accessible now. So ESSA, which is the governing body of exercise physiology, does have a search function available on their website, which allows you to look for an exercise physiologist of specialty in a location that is preferable to the individual, and has a myriad of options available as well. And here you can just see some examples. So some of the people that we've worked with over at the Olivia Newton-John Centre, and some really great examples of people that have experienced those benefits. And I think a big part that's probably not flagged in those benefits is having a sense of control over the treatment as well. Exercise is something that individuals go in, they actively participate in, they have some control over it. Rather than receiving the treatment, it's doing the treatment as well, which can have some really great outcomes and resonate with some individuals to do things that they never thought they would, or enjoy exercise more than they ever thought they would, which is also fantastic as well. Fantastic, thank you. We'll open up to some questions if anyone wants to fire some through. Yeah, go for it.
How do you get from your GP almost like a mental health care plan, but for the physical?
Yeah, absolutely. Yeah, so exercise physiology is one of the services that you can access on the enhanced primary care plan through Medicare, and with rebates available. So often that'll be a total of 5 sessions across different services, whether it's exercise physiology or physio, and dietitian, and some different services are accessible on there. So yeah, it's a great starting point to go to your GP and to provide that sort of referral and get access to that. Yeah, please.
Do you have any maybe advice on whether people should hesitate going to certain things, like back to certain gyms or chiros over physios after having major surgery?
Yeah, I guess it's probably a case-by-case basis. I think in coming back to sort of that, whether it's the medical oncologist or whoever's overseeing everything, because there are some just considerations around what's appropriate, but provided the support and the accessibility is suitable and appropriate, then there's no reason to place, I guess, restraints on it. Or restrictions, but it's just a bit of a case-by-case basis. And if you're unsure, then even going and speaking to an EP or a physio, even if it's just to sort of go, that's perfectly fine. So we do work with individuals both sort of on a face-to-face basis where we're seeing them quite frequently, those individuals that might need a little bit of extra support or guidance or supervision, but also people that come in every couple of months, and we just go, they come in, they say, hey, I want to go to the gym. Great. Here's a program, or here's what you can do and how we can modify it based on what you're feeling. And then just sort of having that sort of reference point to come back to and review and change things as needed.
I work with Blake and actually, and I reckon we probably refer maybe 90% of our brain patients to these guys. So we keep them super, super busy. And sometimes it's not at the start of treatment, sometimes it's once you know, they've got their head around it and they're ready to go that next step. But most people benefit from the program, not just from a physical point of view, but also from a mental point of view. So that's another consideration.
Yeah, absolutely. As I sort of flagged before, just having that sense of control and the ability to something to sort of put effort into and direct some attention to can be really valuable. And individuals often do sort of present with a little bit of hesitancy sometimes. I think it's fair to say, as most of us probably do with exercise occasionally as well. But that's where we come back to that there's always something is better than nothing. There's always something we can do despite where it may not seem like that's the case. Even if it's just some light, gentle upper body exercise or something seated, it can be, a really valuable starting point, and we're able to build off that. So it's certainly, the encouragement is always, even if it doesn't seem like there's something you can do, we are pretty creative in finding some ways to help someone move forward.
I have to say though, access can be a bit of a challenge.
Absolutely.
So I'm in New South Wales, and you know, unless you've got private health insurance or you've got the funds to fund it, it's really inaccessible even in a public setting, you know. I mean, the GP primary enhancement plan's a good idea, but it's just tough to get people in unless they've got the money to pay for it.
Yeah,
If
absolutely.
they're not working, that's a bit of a challenge.
Yeah, absolutely. There are sort of some different pathways, as we mentioned, with the enhanced primary care plan, and and there are sort of services that require sort of more frequent attendance, but it's not necessarily it doesn't have to be that way. So someone can do a lot of this independently at home or sort of with the support of a carer. So there are, alternatives that can be in the picture, but being able to, access is absolutely can be an issue for sure.
Just at the ONJ, have you guys got a service in the cancer centre that does this?
We do. At the moment, we only do work with Austin Health individuals. However, if they're what we are more than comfortable doing though is if you were to contact us, we would be more than happy to look for some accessible and achievable options for regardless of where that is.
Anyway, we've had some of our patients go through on the Telehealth, the Cancer Council, but look, I've got to be honest and say the motivation on telehealth isn't there. And I think you're absolutely right when you say it's not just about the exercise. It's about having somebody like yourself and a team to reinforce it and encourage you and motivate you. And I didn't find that many of our patients stayed motivated with the telehealth, unfortunately.
Yeah, and that is, again, it's one of those barriers to exercise that we all experience, and is a bit more prevalent in the brain cancer space. As I mentioned, sort of referenced before, there's research to suggest that amongst all cancer types, it is the least sort of active group, and that's because there are probably some more profound barriers than other cancer streams, and that's where we really look to, I guess, in addition to all those sort of screening questions and information I referenced before, we also look at what are the barriers and what are the facilitators for this person to be active. Is it motivation an issue, or is access an issue? Is finance an issue? But what are the facilitators as well? What are the things that we can put in place for this individual to exercise more consistently, whether it's developing a little bit of routine or even sort of adapting it to their day-to-day. What opportunities do they have? Do they have someone around them that can be a little bit of a sort of a push to engage in the exercise, and sort of trying to build in with their facilitators and limit the barriers to stack the deck in their favour as much as we can, because at the best of times it's not the easiest thing to do, but if we can build a plan around it, we can find some more success with it.
Great, thanks for the presentation, Blake. Really interesting. And I guess my question sort of builds on that comment from Nick here. Our experience with other cancer populations is very much that the the accountability through the telehealth sessions is actually really helpful. So
Yeah.
if you can build, champions and other things around their facilitators, that's really important. But I guess that's kind of the question that I wanted to go to. How much do you think that you could potentially engage, or are you already doing this with people, even though you're seeing them at the Austin, but are they coming from outside of Melbourne, and do you kind of continue to follow the programs with them remotely?
Yeah, absolutely. And you raise a really good point. We do see people that can only make it down to the centre every couple of months. So it's how we sort of go about creating a plan and building a plan around them, and what opportunities they have and what barriers they face, to build something that is sustainable, which we want exercise and a program to be, and how we can support them in doing that. Trying to promote those facilitators to really create an environment and a situation where this individual can sustain and maintain those levels to experience those benefits. And a big part of that is, sort of alongside education, is that sort of promoting and sort of discussing behaviour change and strategies.
And I'll just add to that comment as well, also for the New South Wales guys. I'm Ash, I'm the lead of the Exercise at O&J, and as well as the Wellness and Supportive Care Program. I'm here to support Blake as well. But I think it's important to note that exercise physiologists are also a fairly small community, and we know a lot of people. So if you're looking for an equivalent exercise physiologist in another state, we're more than happy to sort of engage or provide contacts for you. And I think on the telehealth question as well, we also have wide networks geographically in Victoria. So the conclusion of our 8-week program, while no one wants to leave, which is a great thing, right? It's a good problem to have. We also have that continuity of care with people we trust to ensure that the treatment they've received from us continues into the community in either a supervised exercise component or alternatively in an independent component. I think during COVID, Blake and I probably provided more advice on setting up home gyms than what we did treating patients, but which was good for when we're building bigger gyms. But I think it's important the care that we provide prolongs our 8-week program, and also patients come through a number of times. It's just not the single time, because treatment changes, disease changes, and we want to ensure that their care is provided irrespective of their current state.
I was just curious about, would NDIS cover it?
Yeah, there are certain item codes that exercise physiology does can address in the NDIS. It would just depend on the specifics of funding and the case manager and the different support. That's okay. It's a pleasure.
Okay, thanks very much, Blake. That was great.